my name is Louisa. I'm going to be your nurse today. Can you please say your name and date of birth?
My name is Jenny Sorry, March 3rd, 1995.
Okay, I'm just going to check your ID. Thank you. And what brings you in today?
Just a well visit.
Okay, so I'm going to start with the neuro exam. Do you know where you are?
I'm at Northeastern.
And what year is it?
2020.
And the president?
Trump.
Okay, so the patient's alert and oriented times 3. She does not look like she's in any type of distress, face is symmetrical, good coloring. Are you in any pain?
No.
Okay, so do you mind if I get started with the head to toe? Okay, just swing your legs over for me, please. So I'm going to start with your head. I'm just going to be palpating. So there doesn't seem to be any lumps or bumps. The hair is not brittle, it's shiny. Move on to the ears. Any tenderness while I do that?
Nope.
Do you have any troubles hearing?
Nope.
Okay, so she does have some piercings. There doesn't seem to be any infection going on. I'm just going to palpate the neck. The trachea is midline. The neck's not distended at all. Everything looks good. So now I'm going to move on to your mouth. I'm just going to shine a light in and you just say yeah, okay?
Okay.
Okay, so the uvula is midline. The soft and hard palate are intact. Everything looks good. The mucous membranes are pink and moist. Do you have any toothaches?
No.
Okay, so I'm going to move on to your eyes. I'm going to do the Perla exam. That's just to test your pupils, okay? So I'm just going to shine a light in and you just keep looking straight ahead, okay? Oh, yeah, that's it. Thank you. Okay, so the pupils went from a size 4 to a size 3, then went back to a size 4. Now I'm going to do the cardinal fields of gaze exam. You just keep looking straight ahead and I'm just going to move the pen and you just follow with your eyes. Okay, so your eye movement is intact, so everything looks good. So now I'm going to move on to your upper extremity. I'm just going to do some exams, okay? So can you do a shoulder shrug for me? Everything looks good. Bilateral. Any numbness or tingling while I do this? Nope. Can you squeeze my hands? Very good. Capillary refill is less than 3 seconds. And the pulses, bilateral and present. Okay, everything looks good. So now I'm going to move on to your heart sounds. So I'm going to start with the aortic. It's the second intercostal space, left sternal border. S2 is louder than S1. This is the pulmonic. This is the second intercostal space, left sternal border. S2 is louder than S1. This is the Erb's point, third intercostal space, left sternal border. S2 is equal to S1. This is the tricuspid, fourth intercostal space, left sternal border. S1 is louder than S2. This is the mitral valve. This is the fifth intercostal space, left mid-clavicular line, and S1 is louder than S2. This is also the apical pulse. So while I'm here, I'm going to palpate your carotid, make sure there's no pulse deficit, and there's not. Now I'm going to move on to my bell and listen to those places. No bruise. I'm going to do for any heart murmurs, and I don't hear any. So now I'm going to move on to your lung sounds. Do you have any questions?
No.
Okay. So I'm going to do 6 spots in the front, 2 spots on the side, and 8 spots in the back. So as I move my stethoscope, just breathe in and out, okay? Okay, so your lung sounds are clear. Can you just turn around for me so I can do your back? So here's the bronchial fields. Expiratory is greater than inspiratory. Over here is the bronchiovesicular, inspiratory and expiratory are the same. And over here is the vesicular. Inspiratory is greater than expiratory. Now I'm just going to palpate. Can you breathe in and out for me? Okay, so the lungs expand equally. So everything looks good with the lungs. Do you mind laying down for me, please? So now I'm just gonna check your bowels. Do you have any problems with your bowels?
No.
When was the last time you went to the bathroom?
Last night.
And do you have any trouble voiding?
Nope.
Okay. So I'm just gonna take a listen. There's 4 spots, so I'm just gonna listen to see if there's any bowel sounds. So your bowel sounds are normal, active, so that's good. So now I'm just gonna listen to the arteries in your mouth. This is the aortic. This is the renal bilaterally. This is the iliac. And this is the femoral. So everything looks good. I'm just gonna palpate it, okay? Let me know if it hurts.
No.
So it's not tender, doesn't seem to hurt anywhere. So everything looks good. Now I'm just gonna palpate your legs. Let me know if it hurts anywhere, any numbness or tingling.
No.
Okay. Hair is evenly distributed. There's no edema. Do you mind if I take your socks off?
Nope.
So can you push down? Push up. Okay, and then this is your dorsalis pedis, and it's present. Posterior tibialis, and it's present. So that looks good. Do you mind sliding your legs over? I'm just gonna test your patellar reflex. Okay, it looks good. Do you mind just doing a gait walk for me? So her gait's stable. She's not using any assistive devices. So everything looks good. Do you have any questions?
No.